Dear students, we'll have a clinical case scenario today, which is quite common, especially in the coastal region of India and many other places. That is, just see this what exactly, then you will have the idea. See that entire limb is edematous. Probably this, if you palpate, it will be non-pitting. There was already a healed ulcer here, healed ulcer. And blephs you can that is a blephs denotes that there is a recent inflammation or infection, even though limb itself is a disease in the limb itself is a chronic entity, and so this is naturally lymphedema of the left leg of western into the foot, and currently recent onset cellulitis. It's a healed ulcer is repeatedly, and it could be post DVT ulcer also with edema and cellulitis. So there are two possibilities. Previous DVT with the partial recanalization, and this is quite something like lipodermatosclerosis also. It's called a post-phlebitic leg. That will always cause because of the poor perfusion again. This will cause a similar problem. But first thing you have to think of is lymphedema with the cellulitis currently with the blephs as the part of infection. Usually such blephs occur in a gram-positive bacteria. So that is not uncommon, remember. And so proper examination, inguinal lymph node, peripheral pulse, opposite side, proper history, and usually it is a filial lymphedema is due to mosquito bite, and not uncommon, quite common. It is a morbid disease rather than life-threatening, but it causes a lot of problems, respiratory infection, problem in the work, problem in walking. And other causes are previous inguinal lymph node dissection for any malignancy. Some other infections also can cause. Congenital lymphedema is not uncommon. So there's a different categories why lymphedema can occur. And active infection because of the stasis of the lymph flow, it's a good culture media. And through the finger and with the toe nails in between small cracks, the bacteria enters there and causes infection, especially gram-positive bacteria. So this is how exactly it happens. You need to send the pus discharge for culture. Then you have to do a venous Doppler, because I already told DVT may be there. And also you have to do arterial Doppler. To find out the perfusion, you have to do arterial Doppler. Now treatment is antibiotic, treat the ulcer, regular dressing. Then limb elevation is important. Proper cleaning, hygiene is important, otherwise reinfection occurs. Then blephs, you can always check whether it dries up on its own, otherwise mechanic, open it, and sometimes under the bleph deep abscess may be there. It may be only visible superficial part. That point you have to remember. If you don't open that, it will not heal, and fever, patient may be having a fever, will not subside. They may go for a sepsis. So bleph bleed sometimes only of visible superficial part. Deep part may be there. So you have to be aware of that. That if it is no, you have to drain it properly with a proper incision, and treat the cause, control of sepsis, prevent the patient to go for septicemia, and all these things, because it's a very morbid disease, repeated infection is common. Sometimes we advise long-acting penicillin, benzathine penicillin, once in 3 weeks or once a month, 12 lakhs, but it's painful to take. You have to always give test dose for that, but we're quite effective. Repeated at regular interval antibiotic therapy also often needed in such patients, and limb care is very, very important. Regularly cleaning properly the crevices, toes, and proper wash with the soap, and it is important to prevent infection. And elevation of the limb important, of course. Whenever infection occurs, start antibiotic immediately so that prevent them going for local abscess formation, big extensive cellulitis, extensive necrotizing fasciitis, and septicemia as such. It's a big topic, so please go through my SRB's Manual of Surgery lymphatic chapter, detailed lymphedema with all procedures, surgeries for lymphedema, and drugs for lymphedema, so other conservative compression therapies for lymphedema. Everything is given in detail, and how mosquito bite, filaria, Wuchereria pancreatitis, causes the lymphedema, microfilarias. So all things are given in detail. Please go through that in my book, so you'll have a very clear idea. So as students answer the MCQ, I'll acknowledge your answer, appreciate your answer, put it in the comment box. Milroy disease is A, B, C, D. Go through it and what is the right answer, I'll really appreciate. And second MCQ is Brunner's grading of the lymphedema. Grade 3 is again find out which is correct, A, B, C, D. Again, I'll appreciate your answer. Again, please, I request everybody to go to subscribe my YouTube channel so that you will have the always updated knowledge about the surgery, daily brief, 6 to 10 minutes lectures, so that every day you'll have some other topics to refresh or understand the surgical topics in short period. Other than that, regular intervals, maybe weekly or bi-week, once in 2 weeks, we'll have a live sessions with the case studies, with the interactions. So some students are present in the case, with interaction with not only me, with the senior faculties in different parts of the country will also join. So it will be very, very informative, those live sessions. So also you can join if you subscribe. So my request is, please subscribe my channel, which is free. So quotation of the day is, life is full of uncertainties. That is what we don't know what is for me tomorrow. Only I can recollect my past. So we can't say, even though we plan, your plan is only probability. It is not certainty. So this is what exactly this meaning of this quotation for everybody. Students, please go through my SRB's Manual of Surgery, SRB's Clinical Methods in Surgery, and SRB's Operative Surgery, Surgical Atlas. The new edition has come, and Atlas of Steering Technique. Manual gives everything in detail about all topics as per CBM syllabus: general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, the diagrams, photos, covered everything as per CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there, how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, with again, lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed 2-volume extensive book with more than 10,000 photos and illustrations. Whenever you want to, any surgery, including specialty, general surgeries, gastrosurgery mainly, in detail it is given. It will be very, very useful. So students, also go through my SRB's Surgery Insight YouTube Insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes, and live sessions once a week or once in 2 weeks I am doing. They're also very, very useful for students with the with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram, to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also, with the videos through JP Publishers. And you can always purchase that one for 1 year, so that you can have go through all lectures with a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. So students, I hope you have understood this lecture very well. Thank you so much.